Okay. Hi. Okay.
Should I tell them?
Yeah, can you introduce yourself to the camera?
I'm Carol Phones. I'm a therapist in Mill Valley, and I treat a lot of kids and adults with anxiety and panic disorders.
Okay. So do you see a lot of panic disorders in your patients? You sort of just answered that question, but is it very common in a lot of the people you treat?
It's fairly common.
Okay.
Anxiety and depression are the two major things that bring people into treatment.
Yeah. Okay. How do you usually recommend treating a panic disorder?
Well, there's several ways to go. The first most important for me as a therapist is to make sure I get a history, because many panic disorders are they're genetically predisposed to it. So if mom and dad have had anxiety or panic disorders, that's good information. How long has it been going on? When did it start? Kind of what were the triggers that might have been in the environment. Okay. So that's the first thing I do. And then the second thing I want to be sure of how much is it interfering with their life, and what can we do to kind of pay attention to functionality so that it's not stopping them from growing up or going to work or So I'm always paying attention to that.
Yeah. How would you explain like the disorder in like for like you were telling us like a 10-year-old or someone who wouldn't understand, like if you were to use like medical terminology, how would you explain it in like a simpler way? Like in like
that's a good question. Well, there's a whole range of anxiety, and you have panic attacks, you have OCD, and you have kind of generalized anxiety. So for kids, oftentimes you see anxiety more in kind of OCD symptoms. And then we get to externalize it, and then put it outside of them, and then help them see the ways they can be kind of the boss of it. For teenagers, and adults, we're looking more at what kind of anxiety is it? Is it fear-based anxiety, there's something fearful, or is it conflict anxiety? In other words, they're in such conflict, they've got such mixed feelings, and they can't seem to make a decision, so they get stuck in this very anxious in this very anxious spot. So once you identify that, then you can help kind of have tools to step back, be able to kind of you start to feel anxious or have the panic, you name it for what it is, you claim yourself with kind of a little bit of self-talk, so you say, that's anxiety, I know I can control it, and then you do some of the meditative or breathing or yoga breathing to get yourself more in control, and then see if you can identify what's bothering you. The thing with panic attacks is it usually comes out of the blue. You might be walking down the street, right? And so it's really displaced anxiety. So it's been building up, the person hasn't been paying much attention to it, and all of a sudden they're sweating on the street because they're so anxious. And that's more a build-up, so it's not always a trigger to go to. But if we look at it, we can list all the stresses that might have culminated in that panic attack.
So like I know you sort of just touched on this, but with like, what are like the like main signs of a panic attack? I know you said being sweaty, but like if you were to see someone who was having a panic attack, like what would their like outer symptoms be, or maybe even inner, like their heart rate and stuff like that?
Yeah, heart rate goes up, there's flushing, there's sweating, there's sometimes weakness. They feel faint. For older people, makes you think, oh my God, are they having a heart attack?
Oh my God, that's so scary.
And that's why, it's a lot of people that go to the ER thinking they're having a heart attack, and it turns out to be a panic attack.
In your patients, do you see that it's more common with your teen patients and like child patients, or more with adults that have had like more experience in the world and stuff like that? Is it pretty equal?
It's pretty equal. It's more about stresses going on, genetics, and what they've been going through.
Yeah.
Or sometimes it's trauma related. There's been trauma in the past in some way and hasn't quite been dealt with. And then it have to come out
Yeah.
a little bit later.
Do you have a lot of teens who, like, because of school and stuff like that, or like pressure from their parents, do you have a lot of teens who have like panic attacks because they feel like they're like inadequate or something like that, or anything like that, or that about like college or anything like that?
Well, definitely sophomore, juniors, and seniors,
Yeah.
they have all those pressures.
Yeah.
And yes, I get some in. The good part about Marin County is people are on top of it pretty quickly.
Okay.
So it doesn't develop into panic attacks as much as it's just generalized anxiety, and it's a kind of a way of thinking about how do you manage stress, because the stresses aren't going to go away, it's how you experience the stresses that you want to help the person with.
How you deal with them.
Yeah.
I sort of asked you this already, but with the treatment options, so I know that there's like medication, and then there's what's like is there different like routes you can take with it, or is it mostly you prescribe a medication to deal with it? Is like severity, does it depend on how severe it is? If you like,
Well, therapy, along with cognitive behavioral treatment is, that's what I always do first. And if cognitive behavioral treatment along with kind of understanding what's going on doesn't work enough or fast enough, then I would make sure that they're referred to a psychiatrist for medication.
what would be cognitive behavioral therapist? What does that mean? Just like talking to them, talking through it and stuff like that?
Well, it's really thinking about things like stop, you know. So S means say it, that's anxiety. T means think about what just happened that made me so anxious. O means, oh, when I see a car screeching to a halt, I get really scared.
Yeah.
Okay. And then P is for kind of preparing oneself for, okay, if I'm walking down the street and I hear a car, I'm going to know that I'm going to be anxious.
Yeah.
And so you anticipate a little bit and prepare for it. And that helps. That's a very simplified version of it.
Yeah, I'm sure.
And then every patient has their own way of kind of having, I want to say, 3 or 4 steps that they know they can be in charge of the anxiety, even though it at times feels like they're not in charge.
Yeah. Okay.
Empower them, in
Yeah.
other words.
Okay, let me ask that question. I'm sure that it is like debilitating for a lot of patients, and like it does limit people. Do you know, like, can you think of any like situations where it would like limit someone specifically? Like, would they not be able to do certain things because of their like panic or anxiety disorders?
Yeah, some people can't leave home,
Yeah.
or they can't go to school, or they get what do I say? Airplane phobias, you know, they can't get on an airplane because of the anxiety is so high.
Yeah.
So yes, and that's what you're always assessing, is how much is it causing a problem in terms of what they want to do. Is it blocking them? And if it's blocking them, it's a problem.
Yeah.
And especially for kids, you want to make sure kids are not blocked from experiences or opportunities because of anxiety.
Yeah.
That's terrible. Don't want that.
Okay. Well, that's all. But yeah.
Okay. What? Anything else
Yeah.
about anxiety?
Or panic disorder.
I'm always on the side, and you know this. I'm
Yeah.
always on the side of get on it quickly. Find
Yeah.
somebody that you can really talk with about, because people don't have to suffer from anxiety.
Especially in today's day and age where we have all these treatment options and stuff like that.
And the treatment options, especially these medications now, are so, the side effects are so minimal, and you get on with your life in such a more gentle way.
Yeah.
And it's so exciting.
Yeah.
And so to teenagers, especially, or young kids, I say, get on it quickly. Don't suffer.
Yeah,
with
no
it.
one should have to suffer.
Yeah, exactly.
Okay.
And the last part is everybody has to deal with anxiety, and everybody has to be proactive with making sure they're paying attention to their stresses.
Yeah.
And taking good care of themselves. And that's the kind of the mental health part of living a healthy life is important. We always have to be checking in with, my anxiety high today, or especially if we're prone to it, or you know, what's happening that I can't quite experience what I want to